All right, good morning, everyone. Thank you for being here for the July 5th CAB meeting. Welcome. Hope you had a wonderful and safe holiday yesterday. My name is Melanie Green, and we will start with some introductions because we have a new board member joining us today.
All right, I will go through the list. Bridget McCleman.
Yes, my name is Bridget McCleman. I represent District 2, maybe, as a community member.
David Poland. Councillor Diana Perez.
This is David here. It says, hi, my screen is having a bit of a time freezing up and everything, he says.
Hello, this is Councillor Diana Perez.
We have new board member, Councillor Ernie Sachs from the city of Washougal. I don't see any ability to speak from Ernie, but I do see that he's here. Jamie Spinelli.
Morning, I'm Jamie Spinelli, low-income representative for District 1.
Karen Kamara.
This is Karen Kamaroff, low-income representative, District 2.
And then in the room, we have Amy Borg.
Yeah, community representative for District 1.
And Melanie Green.
Hi, I'm Melanie Green. I'm board chair, and I'm community representative for District 4.
And we have, for staff, we have Michael Torres, Janet Snook, and myself, along with new staff members. Abby Malloy is a new program coordinator with our department and our unit, works directly with Michael and myself. And we also have Liz Kearney in the room. She's also a new staff member with the Department of Community Services. She will be bridging programs between our behavioral health programs and our homelessness crisis response system programs. We also have joining us in the room, someone from Family Promise. Would you like to introduce yourself?
My name is Shane Scout, Executive Director for Family Promise as a visitor.
And joining us online, we also have Ann Hawkins from the City of Vancouver.
Good morning, I'm Ann Hawkins and I'm an assistant planner at the City of Vancouver, and I have been tasked with developing the consolidated plan.
And we have our interpreters, and then we also have board member Nakia Hunter has joined also.
All right. So I showed that we have 9.
Yes,
So
we
we
have
have
more.
more.
Thank you.
Perfect. Thank you, everyone, for joining us today. So first, we're going to get started with the minutes. Hopefully, you had a chance to review those. Would anyone like to make a motion to approve?
This is Karen Kamaroff. I make a motion to approve the meeting minutes from May.
I'll second Bridget McCleman. I'll second that motion.
Thank you. Any discussion? All right, we would like to make a motion to approve the May 3rd minutes for our last CAB meeting. All those in favor say aye.
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 Anyone say nay? All right, meetings are approved. Thank you. All right, next we're going to move to our next agenda item. We have some task force updates. Amy, do you want to provide us with the legislative advocacy updates?
Yeah. No, Second.
Has there been any changes or anything that has come to light since the legislature ended?
A lot of things, but no, nothing. I read the second, but
Great. All right, thank you. Rebecca, do you want to update us on the community needs assessment?
Yeah, so we have, since our last meeting, we have hired a consultant to look at the data. We will be meeting with them this week. They have the data from the surveys and they'll be reviewing that and perusing that data, putting some charts together, looking for bias in the responses and anything else that we find in trends that we want to look at. So we'll be moving forward with that. The task force hasn't met because we haven't had anything really to present to the task force regarding the data from the surveys. We received a little under 900 total responses, still an okay response, but definitely not anywhere near where we were hoping to be with the responses. We know a lot of that is due to the pandemic, coming out of the pandemic. The outreach efforts weren't as strong because a lot of community meetings were happening where I would be able to hand out surveys. So that's kind of where we're at. 900 responses, still a strong response for our surveys. So we're still glad to get that information. And then we will continue moving forward. At the next CNA task force meeting, we'll look at some preliminary data, more about demographic information of the respondents. And then we will start working on putting together our community forums and focus groups that will happen late summer, more likely fall into early winter, so we can collect that data to put into the needs assessment.
Great, thank you. Okay, so next we're gonna invite Kayla Williams to share some information about the eviction prevention rental assistance program, and we are gonna be asked to form the subcommittee, be part of that selection. So Kayla, do you want to give us more information?
Good morning. Yes, so this is just a follow-up on the House Bill 1277 funds that have come through the Consolidated Homelessness Grant and the Systems Demonstration Grant. So we have the RFA open for providers in the community to apply and give us some more information on prevention programs that they may already be running or that they would like to get started in the community that we will fund with these dollars. So at this time, we would like to request 5 CAB members to review on a committee for approval of the RFA.
Great, thank you. And it looks like we have a timeline for this process. So we're asking for 5 CAB members to form a review committee to review the applications. Is anyone interested?
I will.
Amy? Thank you, Amy.
What we would do.
Yeah, so sorry, so
Roland was asking, what would that committee be doing?
So the subcommittee will be reviewing all of the applications that are submitted. So this will be very similar to when we did our large community action program, the homeless crisis response system RFA, but there won't be nearly as many applications. We don't know exactly how many applications that we'll see coming in yet. If we get a lot, we will, it'll just be more time. We estimate about 45 minutes to review each application. Just like the previous request for applications, there's a scoring component that the board subcommittee will work on to put the scores together, and then we'll do just like we did before with the ranking. The highest scored programs would get funded until we run out of funds. And so it's going to be very similar to what we've done before. We are getting the applications due July 21st. Staff will then do their initial review, just like our previous process, make sure that there's a clear understanding of the application, make sure that the programs are applying for something that is eligible and appropriate for the program. And then any remaining applications will be sent to the subcommittee for review. We're hoping by mid-August, but we will get them to the board as fast as we possibly can. The subcommittee will then have, we're hoping about 2 weeks to review all of the applications, submit their scoring, and then we'll determine what the top ranked programs are. The subcommittee will also be moving and approving those applications to the county council, which is why we need to have an approval from the full board to give them approval to actually move the applications forward on behalf of the full board. So it looks like we have Amy, and I was hoping to have 4 others be interested.
I don't mind volunteering, but I'm away the first 2 weeks of August, so that's.
We won't have them the first 2 weeks. You'll get them like mid-August. So that might actually work pretty well in your timeline.
Okay.
Thank you, Bridget. So we have Amy and Bridget. Can we get 3 more board members?
Is he speaking?
When are they due again? This is David. When do they do?
So we will have scoring by September 1st. So the work will be over the last 2 weeks of August, and then we would like to have the scoring by the subcommittee by September 1st.
This wouldn't take nearly as long as when we do the bonfire normally, would it? Or is it?
It's also through Bonfire. The nice thing is that this is one program rather than the others that were multiple types of programs. So you're really going to focus in on a prevention program. So you're easily able to compare the different programs that are coming in.
Okay.
Okay, I think I can do it if it's the last weeks of August, and I won't be here in September.
Okay. Thank you, David.
I'm happy to participate.
Thank you. That gives me Melanie, David, Bridget, and Amy. Is there anyone that is?
This is Karen. I would be willing to do that.
Thank you so much, Karen. That gives us 5. So if we can have a nomination and vote on that subcommittee, that would be fantastic.
Yes. Okay. So I make a motion to nominate Amy Borg, Bridget McClellan, David Poland, Melanie Green. Can I do this because I'm on the committee?
It should be someone, actually, because you're chair, it should be somebody else that is not chair that does the nomination.
Okay.
This is Jamie. I move to approve all 5 of those.
Thank you, Jamie. Do we have a second?
The same we work, I second it.
And final vote.
All right. All those in favor say aye of the selection committee, say aye.
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 Anyone opposed, say nay. All right, we have our subcommittee. Thank you, everyone. And I'm assuming information will be sent out via email for when that time comes.
Yes, so we will keep that subcommittee informed throughout the process, so they know when they should be expecting to see those applications. You'll get an email from Bonfire that shows that you have access to the applications. And for those of you, I think all of you actually have used Bonfire for the last request for application. So very similar process. Kayla will be your point of contact for questions, and Bonfire will be the contact for any technical issues with the system.
Do we know the dollar amount that's being awarded?
Kayla, I think it's 4.5 million. No, it's bigger than that. Kayla, I'll let you answer that.
Yeah, so it should be 4.5 for the first fiscal year and next fiscal year, and that's because of the allocation of 8 million that we need to get out. We did not expend out the previous allocation for last year as we were still setting up the RFA process. So we'll have more to spend out this year and the next fiscal year. But as the grant is built into our SDG allocation moving forward, we expect to have about 2 to 2.5 million allocated each year from Commerce.
Great, thank you.
Excuse me, this is Ernie. Am I on now?
Yes, we can hear you, Ernie.
Okay, I somehow I was left out because I said I'd volunteer for that committee, but now that I'm on, thank you.
Thank you, Marty. Would you like to do an introduction to the board?
Sure, if this is the right time. I'm Ernie Suggs. I'm city councilman on Washougal, and I've been on the council for about 6 years. My background is community education. I was a community education director for Camas Schools for 32 years. I ran everything that didn't involve K through 12. I put on classes, activities, and special events for the community, and rented facilities and had a great experience adapting and working with the community of Camas and Washougal. So that's me.
Thank you, Ernie.
All right, and Rebecca, do you want to walk us through the outcomes report that you put together?
Yes. So for those in the room, we have a much bigger version that you can look at. So it'll be a little easier than those that are online. I did email this out on Monday. My goal is to give these reports to you for our meetings. If you noticed, it was a very late night for me to get these out to you guys. So you do have them available. They'll also be available in the follow-up email for you. So you can, if you didn't get a chance to look at it before the meeting. As you know, this board oversees all of the community action programs and the homeless crisis response system programs. And there's quite a bit of activity that is going on. This is the first actual report that you've seen with real numbers from the programs for this fiscal year, which started July 1st, 2022, through lots of capacity issues and delays. We were finally able to get this all put together for you. And so this is how the report will look going forward. And so there's some really good information in here. So every program that is regularly funded through the request for application or through our shelter systems that are sole source or non-competitive grants are represented in this report, starting with the community action programs. So you should be seeing 3 quarters where this is the third quarter report. So 75% of goals and funding is where we would like to see all of the programs. You're going to see quite a bit of way over, some that are under, and you will see so, just kind of all over the place. And the big reason for that is we still have a lot of COVID related funding that our programs are really focused on spending those dollars first. But their outcomes are kind of blended in together or combined together. So the outcomes might be a lot higher, the spending might be lower. We also are noticing that a lot of the programs are still trying to figure out how to target, coming through the pandemic. So targeting their proposed annual goals are off quite a bit. We typically go the first year, take a look at how they're doing there, see if there's any adjustments that need to be made in their proposed goals. And then second year of the contract, we really take a closer look. A lot of times it's just an anomaly in the situation right now we're dealing with, coming out of the pandemic. So the numbers are going to look really kind of not typical for those of you that have been on the board for quite a while. But there's a few different outlining things going on. A couple of things that I wanted to highlight from this first page with the community action the community action programs. The Clark College Financial Wellness Program, they were funded through the previous request for application, but they've gone under new management. They have new staff working. And so the way that they are counting their outcomes for the different goals that they have has been a little bit different. So you can see they look as though they're overachieving this program quite a bit. So we will be working with them to adjust their proposed goals to be more appropriate for the program and what they anticipate seeing. Another one I wanted to mention was the Battleground Healthcare Dental Expansion Program. This one actually didn't get started in spending until the very end of 2022, really more into 2023, where they now are really moving that program up and running. But they were able to still do some dental visits a little bit earlier on, and they've seen overwhelming demand for dental. We knew this was going to happen as dental has always been really high on our needs assessment. So I'm not surprised, but Battleground Healthcare was kind of surprised to see how many additional people they were able to assist. So with that, you can see that the spending was a little bit lower, but their outcomes are higher. And then the third one is one that we typically mention is the Share Hunger Response, where they bill the grant, the Community Service Block Grant funds first before they use a myriad of other funding that they receive for the program. So we often see that program spent out early. Any questions for the Community Action Program page?
This was an overall comment. There's all the right information in there. It's really nice and clear and easy to understand. So I just want to congratulate you again. I know I've been whining about the reports for years, so this is wonderful. I did notice you said something about sole source non-competitive funding, and I wondered if maybe there could be a little asterisk beside the program so we knew that which ones those were. And the other
Shelter, really, that's the main one, and Lincoln Place is one.
Okay, yeah. The other thing I mentioned is nothing to do with this report, maybe, but there's the funding for the community foundation. It would be really good for CAB to have an update on how they're working that and how it's going and that sort of thing. It was a direct allocation, I think, by council, so we didn't review any proposals for how that would work, and it would be really nice to understand just what they were doing and how successful it's been. Thank you.
I can ask them to come in and give a proposal or a presentation to the board.
That would be great. Thank you.
Rebecca, this is Diana Perez. I have a question. I have a question for you. This is nice. Just want to echo what Bridget mentioned. I was wondering if there was a process, or if there is a process, to really look at the qualitative nature, the quality of services versus this number of. Is there some type of system in place to look at the quality?
So one thing to note is that this is just a very brief snapshot of the program. The quarterly reports that we put together from the agencies look at outputs, which are just service transactions, outcomes, which is primarily what we try to report here. There are some programs like food assistance, which is really more of a service type program than an outcome-based program. But we do take a much deeper dive into all of the programs with their quarterly reports. We also do regular monitoring of the programs to verify that they are really meeting all of the components of the program. And so on the staff side, we definitely take a deeper dive into all of the programs.
Along with the quarterly reports and the end of year reports, we also ask for summaries of client satisfaction surveys, and we also ask the service providers to report on any grievances that have been submitted during the reporting period and what the outcomes of those grievances were. So overall, we do get a fairly decent picture of the quality of the services and the client satisfaction with the services that are received for the programs. For brevity purposes, we do try to report to the CAB the overview of the information. And the reason for that, kind of as Bridget alluded, we've tried different reporting formats to the CAB in the past, and we continue to fine tune. I'm sure that it will continue to be fine tuned, and what we report actually gets changed. Some of those components have been reported in the past to the CAB, and the feedback we were getting was to throttled down a little bit because it was just too overwhelming, and the request has been towards what you're seeing right now.
This is David Pone. Can I add a follow-up question to what Diana Perez said? I'm curious, when we're talking about any concerns or complaints from people that were receiving services from people that are getting grants through the county that CAB had approved, and the feedback from them through their services, is that feedback or complaints going by the applicant filling out the form or online? Is it done in different languages or just English? Does it include ASL version? And is it done in the offices of the place where they do it, or is it sent directly to the county? And the reason I ask that is there can always be unintentional fears of sometimes people who are minorities that are receiving services. They don't want to upset the person that is giving help. Deaf Community gives examples a lot of times, so I want to give a brief example. One time a person that was homeless told me that there was a lot of people that were homeless that were having problems in this particular agency, and they were afraid to say anything because they're afraid of genuine retribution by the people that ran this agency. When a person representing the agencies, well, I will represent you and say something to that person was then fired. So that's why I wanted to know how does the system work so that people can provide that feedback if they do have a complaint or concern?
So Rebecca, let me I'll be as quick as I can. So we don't do that directly. Like, the feedback is not submitted by the client directly to the county. We require in our contracts for all the service providers to collect the client satisfaction surveys, to have grievance policies in place, inform clients of those grievance policies, and to report to the county what the results of the surveys, the results of the grievance processes are. Because we are not, first of all, we don't have the relationship with the client. We're not providing the service. We don't have the context. And we're also not staffed or structured to administer that kind of process. So that is done through each service provider.
I'll also add that for all programs, we require a copy of their policies and procedures, which includes how they were doing their client satisfaction and grievance processes. They are required to make the forms available in languages pertinent to the clients that they are serving. They're also required to have the surveys and the grievances available either in writing, verbally, and also available to give their grievance to a party that is not their case manager or the person they might be grieving against. So we do have those requirements when we review their policy.
Thank you, Michael. You answered my question. There is a process in place. So appreciate that.
Thank you for the question. Rebecca, you're muted.
I'm unable to see the interpreter. It's freezing out.
Can anyone hear Rebecca?
No.
Okay, Rebecca, you're muted.
Yeah.
I will message Rebecca separately. I don't think she realizes.
I had a follow-up question, if I may. This is Diana Perez again. Is there, and I'm sure there is, Michael, we talked about disaggregating data to show where in the county some of these services are being implemented, or is it just really too complicated to do that?
Give me, phone is ringing. I'm also calling Rebecca. Are you asking me if there's a way to aggregate the physical location where the services are being provided?
Yes, and then in addition to perhaps some of the folks who may not, for example, if the service location is in a different part of the county, but the customers are from another city on the other side of the county. I'm not sure how that translates to services.
So we don't have a system to do that. Wait a second. I apologize. I'm trying to do.
No worries.
So we most of our services, the eligibility is not based on where the service is provided. The eligibility is based on income status, housing status, some other aspect of status. And we have cases where, like with outreach workers, services go to where in the field where those clients are at. That includes also like Housing Solutions Center doing housing assessments for coordinated entry, things like that. And then you have other situations that also includes some variants of food assistance. So various services that try to meet people where they're at and go in the field. And then there are other services, for example, shelter, some cases of work programs where people go to where the office location is, and we collect data of the demographics of where those people are from. So I think we have a fairly good system to show the origin of like who's receiving the services. I don't think we have a good system to show where the services are physically received, like in a way to kind of get to where you're going in terms of quantifying expenditures geographically or service levels geographically. Just the system is not made that way. So
Gotcha. Okay.
yeah.
So Michael, oh, Rebecca.
I just know that I apologize, we had technical issues on our end, but the staff in the room are now back in the meeting.
Okay, I had a question for Michael.
There's no interpreters right now.
Sorry about all the technical issues this morning, everyone. Yes, Bridget.
So I was playing around with the numbers in this, and I know you've made a case that shelters are the most expensive way we deal with unhoused individuals. But when I look at the numbers, it looks like it's and I know this is a crude measure, but it looks like it's about $1,860 per person for shelters that we're funding. And 5,597 for PSH housing, and 11,835 for RRA funding. And I know you've got a good case you make that the shelters are an expensive way to go. I wondered if, with new members here, if you could explain that.
I will be as quickly as I mean that we're getting into some deep dive, but yes. So first of all, when we talk about cost between the different types of intervention, I don't want to give the impression shelter bad, shelter expensive, don't do shelter, do something instead. Okay, because the reality is you need a continuum of care. You need all the things. You need a good, healthy shelter program, and you need other interventions so people can get out of shelter. When you're evaluating cost, we don't evaluate cost by number of persons served. with shelter, specifically with shelter, and this is not just Michael opinion, this is in general like how it's done nationwide, is you look at your total cost per bed over a given amount of time. And the reason for that is because if you just looked at number of persons served, the more people you serve, the cheaper it would look, and it makes no account for how long the person's been in shelter, where did they go after shelter or anything like that. So if we really looked at the annual cost per shelter bed for county funded shelters, you are, and the cost has been steadily increasing, so like in 2022, it was nearing or just going over about $20,000 per bed per year. Okay. And I'm expecting it to be significantly higher in 2023, just because of the different increases in cost. If you tried another way, you could look at it if you were really looking at like the cost per person served. We wouldn't look at it total cost per person served. We would try to find what is the cost per successful exit, and then you're really looking at costs of and I'm kind of going off the top of my head here just because I don't have the numbers in front of me, so don't quote me on this. Like the county's like numbers for successful exits for shelter are this amount. But in the ballpark of above $40,000 per person per year for a successful shelter exit.
Wow.
So and rapid rehousing is very expensive. Like last time I looked, but then you're looking at like, what are you paying in rent and services, PSH is very expensive. So you have to fund all of them. Like if you can break a system by only doing permanent supportive housing. You can break a system by only doing shelter. You need to develop both, and you need to have a balance so that you can have a continuum of care. I'll just leave it at that. I know that we need to get back on track.
I appreciate it. I needed to hear that again. Thank you.
Okay, so I know that a lot of what I was saying before didn't get caught by the team that is attending virtually. So I will follow up in the email with a little bit more explanation of the satisfaction surveys and grievance processes, so you have that information. And just wanted to let you know that throughout the report that you have in front of you, in each of the different types of interventions, we try to provide the same outcomes for each program so that we can kind of see the differences between the different programs, but are seeing the same types of outcomes. For the homeless crisis response system, some programs that I wanted to highlight, one is the Council for the Homeless Housing Solutions Center. They continue to see a significant increase in assessments for their services, especially around our prevention programs where there's no way to propose a target of how many people they would be serving for that program. Catholic Community Services is a new provider in Clark County, and they're establishing their targets for their non-congregate shelter programs. The initial target is really the number of beds that they have, but they do see households exiting out of the program. So the outcomes are higher than they had originally proposed. And because they're a new program, we'll work with them on how to better target the services that they're providing for future reporting. The adult motel voucher and prevention programs, just overall, both of those area intervention types, we're seeing an extremely high demand for services. So you'll see their outcomes are really very high. And then New Life Friends Church is also a new agency operating housing services, brand new to us, working in the community. And so they took a while to get their program up and running, and then we'll be working with them to ensure that they meet their outcomes. On the last page of the report, this is kind of an overview of some of the different areas that we were talking about. So the bottom part, the demographics, this is very similar to what you've seen in previous reports where it's just a general overview. This includes all individuals who have been served in the system who provided their demographic information. Not everybody is required to provide that. And so they'll see the demographics of the people that are being served currently in the programs. You'll also recognize the participant satisfaction meter that we've been doing the last couple of years. We received 683 responses to the satisfaction surveys that were provided so far through the first 3 quarters. That there's about a 21.4% response rate from this surveys that have been distributed out. And of those responses, 88.6% indicated a positive overall experience. And just as a reminder, every agency does their satisfaction surveys differently, customized to their programs, what it works best for them. Youth programs will be very different than something that you would see in the adult system for housing services. Community action programs will look very different and customized for the types of services they're providing. But they are all required to ask one question about the overall experience. And that is why we bring that information to the board. Something new in the report this time around is around our community engagement. Many of our programs have volunteers and could not operate without the volunteer support that they have. So we wanted to give you just kind of an idea of what we see in the programs. The number of volunteers is that little blue bar. There's 1,468 volunteers in the first 3 quarters for all of our programs. Of those volunteers, they donated 18,000 hours of time. And of those hours, 4,245 were from documented low-income individuals. Not all programs ask about income status with their volunteers, so this is definitely an underreporting of the low-income volunteer hours, but it's definitely something that we want to highlight where we can. And then if you were to put a value on those volunteer hours, the current valuation is $29.95 per hour. So really the programs are receiving almost $540,000 of free labor through those volunteer efforts. So it's pretty amazing. And then also new to this report is the agency grievances. So as Michael was saying before, we want to be transparent and let you guys know what's going on with those grievances. Really, inform you that we do take a look at them in the reporting process for each of the programs. For all of the 47 individual programs that we currently have operating under the Homeless Crisis Response System and Community Action Programs, there were 27 grievances filed with those agencies, and 25 of them have been resolved. It's a 15% of the programs are seeing any grievances at all. And the majority of the grievances have already been resolved. Some grievances, depending on what they're about, can take a little bit longer to resolve, so we're not concerned that not all of them are fully resolved, and we will be paying attention in the next report to verify that everything was resolved at the time. So that is your brand new outcomes report, all 5 pages of it. If there's any, things that we can do to help make it a little bit more understandable, then, we're happy to look into that. But we know that this is a large report, and we do the best, trying to make sure we provide as much information for the board in an understandable way. So if you have any questions, I'm happy to answer those.
What I do, why is there so many different responses, like different,
in the demographics?
Yeah.
Because not every program asks. Our food programs don't ask any or very little demographic information. They usually get their gender, but that's about it. Our hunger response program does get ages because they're school kids, so they're able to get the ages in there, but the Hot Wheels program does not ask for age. And so every program just asks different demographic information. And that's why we specifically state how many are actually in each of those demographics, so you can have a better understanding of what the numbers look like for the number of people that responded. Any other questions?
Yes, hi, Rebecca. Thank you. the satisfaction information answered my first question, so thank you. I also wanted to follow up a little bit on that, the grievances piece. Is there, of the 25, or is there a way to would you say that that's more of a process improvement or accountability? Not necessarily wanting to dive into the type of grievances, but just trying to understand, where there's room for improvement, where we can influence that betterment, in terms of, is it more of a customer service, a language barrier, ability, just really trying to hone in, versus accountability, meaning that, there was very poor customer service, or, somebody's civil rights impeded on. So just wanted to see if there was a way. You don't need to dive into it now, but I'm just want to know if that is of interest to the CAB. And then following up on the data of the demographics, just seems like if it's every program doing it differently, how are we really looking at it holistically for improvement when we're looking at data across the board? And by funding these organizations, is there a way that we can require certain data be gathered?
So there are certain requirements, like the USDA, it requires that food programs do not collect any information. And so we can't override the federal program, another federal program for their requirements. That would make it for us not able to fund those programs. I don't see that we will require specific demographic information. The HMIS system does have some minimum requirements that they have, so they can delineate between individuals entered into the HMIS system. But other than that, we do not want to put unnecessary barriers on access to our programs. So the demographic information is really just information, just extra information that we provide for the CAB. So you can get a somewhat understanding of what is going on. We work with each individual programs as needed regarding the participation in their programs. We look at them for equity, access into the programs, equity and outcomes of the programs. That is done on a separate process. The grievances, each program coordinator is responsible for their own quarterly reports, and then looking at the grievance processes. So as an overview, I don't look at every grievance summary of grievance that is provided by the organization or by each of the programs. So I wouldn't be able to give you an accurate understanding of, an overview of what is going on in the programs. And just I look more at the numbers of how many there are. If there are serious grievances, those get handled by the program coordinator for each of the programs and talk directly with the programs.
Okay.
All right, thank you, Rebecca, for the information. I think looking at time, we should move along. Appreciate how clear the report is, and I know it's gone through a lot of evolutions, and it's just very clear and concise, and so I appreciate all the time and effort we've put into this. It's a lot of information. Thank you so much. All right, so we should have Samantha and Jamie here from the City of Vancouver to give us a review and an update of the City of Vancouver affordable housing and homelessness services.
Good morning, this is Sam. Hi. I have a bunch of exciting housing updates from the City of Vancouver this morning. So just this week, we finalized the updates to our MFTE program. That's the multifamily tax exemption program that gives developers an exemption on their property taxes to build new housing in certain areas. And it also provides some affordability. What we've prioritized with the program changes are density and affordability. So, and we've also expanded the regions where we will allow MFTE around the city along the bus rapid transit lines, because we want to incentivize housing next to transportation to make it easier for folks. And as part of the changes, we used to let developers propose a public benefit along with their market rate project. So maybe that looks like a park improvement or some artwork and some fancy sidewalks. And so we've done away with all of that. It took a lot of time for staff to negotiate and figure out what the value was. And we've just, anytime there's a market rate development, there'll be a fee in lieu, and that fee in lieu will be used to invest in deeper affordable housing. So I'm excited about that. So far, we've had 4 or 5 projects that were recently approved under our old program guidelines, but they saw that this new opportunity to not negotiate with the city on how much their sidewalks were worth. They saw this opportunity to use a fee in lieu. So already we haven't collected it yet, but they have proposed $6 million for fee in lieu over 5 projects that we've recently approved. And they need to pay this fee in lieu before as construction is completed. And they have 3 years to complete construction. So that money will be coming in over time. And we are developing the policies of how we'll use that funding for council approval, but we're looking at 60% AMI or below for the fee in lieu. And then we have the Affordable Housing Fund. The last of our existing levy that ends in 2023 is open right now. We opened it the middle of June, and it will close for applications July 14th. It's just about $2 million that we're looking to invest in housing production or preservation. And so we'll collect some applications and make some final housing awards with our 2023 levy, and we'll be ready to launch the 2024 applications next spring. And then lastly, I just wanted to mention that we are working on our 5-year consolidated plan, which sets the strategies and goals for our federal CDBG and home dollars. Ann Hawkins has been working on that on our team, and she was hoping to come to your next CAB meeting and provide a little bit more information about that and get some feedback and direction from you as far as how we should prioritize our federal resources over the next 5 years. I think that's all my updates, unless anybody has any questions. Thank you.
Thank you.
Hi, I'm Jamie Spinelli, the Homeless Response Manager for the city, in addition to sitting on the CAB. I think I only have a couple updates. Since the last update, council approved a contract with Do Good Multnomah to run, for them to operate Safe State Communities 4 and 5. So it's exciting to have a new service provider up here. And then last week, council approved the ability for us to move forward with the site at 4611 Main Street for Safe State Community 4. So we should hopefully see work beginning on that here in the next month or so. And then we did hire an additional heart outreach worker. His name's Steven, and he was the lead out at Safe Park. So I don't know if any of you have worked with Safe Park ever, but he would be familiar if you have. And I think that's all I've got.
Is Safe Park the one? Is Safe Park the one on 136th or 138th, the old transit center?
It is, yeah.
Can I ask what the status is of the downtown Safe State? Number 3,
Yeah.
I guess.
It is number 3. So we had to contract with a designer for them to create the bid package for the construction work. And it sounds like that work is almost finished. So we should have everything we need for a bid package to go out sometime within the next week, is what I've heard. So once that happens, once we have that and the bid package goes out, it has to be open for 30 days. And then the bid closes, we take the lowest bidder, and then we can start work.
Do you have a location for number 5 yet?
We don't, not yet.
Any other questions?
Do you have any numbers on how many of these people that have transitioned out of there?
The last May data I have, oh gosh, how many was it? I think it was like 58. 58 had transitioned into permanent housing or stable housing as of the beginning of May, I think.
All right, thank you so much for the updates. We appreciate you.
Sure.
All right, and next we have Dale from Council for the Homeless, and he's going to update us on the point in time count and Project Homeless Connect. Welcome, Dale. Thanks for being here.
Good morning, everyone. My name is Dale Whitley, like I mentioned. I'm the Project Homeless Connect and Point in Time Count Coordinator, and as well as the Homeless Management Information Systems Administrator.
Dale, you should have the ability to share, correct?
I hope so.
Okay.
Find out. Okay, hopefully everyone can see that. So let's talk a little bit about what the point in time count is. So it's a single night snapshot, and it normally takes place during the last Thursday in January. So it's required by both HUD and the Washington State Department of Commerce. HUD actually only requires an every year count, but the Washington State Department of Commerce requires us to do it every year. So we do it every year. And so it allows us to view trends and you know, I sort of like a high watermark on a river to see whether our numbers are moving up or down every year. We try to use any new tools as possible and increase the effectiveness of our count. So we're always looking for ways to innovate and improve and make a more thorough and accurate count. And so, like I mentioned, it enables better planning and funding determinations based on trends that we may see in the data. And it's important also to remember that it's just the best available data that we have. So it's a one-day count. So we're tasked with trying to count everyone that we can that's experiencing homelessness in our county on a single day. And so when we look at these numbers, it's always important to remember that really just we're looking at one day. So this year our count took place on January 26th, which was the last Thursday. So there's two major pieces of the point in time count. There's a sheltered count and there's the unsheltered count. So for the sheltered count, we're able to use our homeless management information system. All of our shelters are entering their clients into that system, and so we're able to easily pull that information from there. Our unsheltered count, so that's where we have to do a lot of our planning to do these street counts and such to collect the information from people that are living outdoors, not in our shelters. So we have non-HMIS service locations. So those are the places that provide services, but are not part of our HMIS. If they were, we could pull the information from there. And then our school district homeless liaisons, they submit their numbers for their students and families experiencing homelessness that they're working with. And then, of course, a big part of this whole project every year is coordinated our street count. So that's where we have teams that go out and literally survey people on the streets or in encampments wherever they can be found. And then another piece of our major data collection point is our Project Homeless Connect event. And so this is a service fair that we hold to coincide with the point in time count. This year and for the past several years, it's been held at St. Joseph's Church on Andreessen. And so we advertise it in advance and let everybody know that this is a day where they could come and get a hot meal and clothing and medical care, dental care, vision, they can get glasses, clothing, all kinds of services that are available for them, haircuts. And then there's also many of the agencies who serve people experiencing homelessness in our community are there tabling as well, so they can connect with them. They could get a housing assessment from the Council for the Homeless, or they can get connected with many of these other agencies as well that are there. And so it's a great event. It's a great day to see all these agencies all together under one roof, all these people getting services, and so that's just always a great event, and it's really important because we collect so much information from people, or so many people are counted there. So some of the highlights from this year we were able to use or access our year-round professional outreach teams who planned and performed the street count. So there's been a major expansion in our number of teams and outreach staff over this last year. And so while in past years we've had largely, or many volunteers, just citizen volunteers, this year we were able to primarily staff it with year-round outreach people who already have this experience. They know where people are. They're familiar with HMIS and the information that needs to be collected, and already have these relationships with the people that they're surveying. So I really think that was just a great achievement and enhancement to our count, that they were able to have these relationships already and be able to collect this information more thoroughly. And I'll loop back to that later. We also, for the 4th year, used our mobile app. It's called Counting Us, and this has been a great boon as well for the count, purposes of the count. Prior to the app, every survey was filled out on paper. In January, or last week in January, it's often very rainy and wet. These papers would get all soggy, and it's hard to write in. And people felt that it was kind of a barrier to have this big clipboard between you and this other person, where it's just easier and simpler to collect the information in this app and more accurate. And so that's been a great advancement for us as well. We also saw a return to the pre-pandemic attendance rate at the Project Homeless Connect event. So the pandemic really, threw us for a loop with the Project Homeless Connect event, our ability to safely hold that. So there was one year, I think it was 2021, where we weren't able to hold it at all. Almost every community got a waiver for the point in time count, because it was before even vaccines were available for most people. And then in 2022, when we returned, it was kind of more of a stripped down, more social distancing affair. And that this year, it was like I said, a return to the pre-pandemic numbers. So we had, I think, 317 guests attend the Project Homeless Connect event this year, which is right in the range of the numbers that we were seeing, prior to 2020. So here's just a photo of somebody at the event getting some shoes. So here's a page. This is a sample of some of the results from our point in time count. This, as well as many other infographics like this, are available on our website. If you go to councilforthehomeless.org, look for About Homelessness, and then there's a point in time count page. You'll see this and some other charts as well. So we have our numbers for 2023, and then we also have some comparisons to 2022. So you can see overall, altogether, 1,300 people were counted on January 26th, and that was a 9% increase from the previous year. The previous year's count was actually February, because there was a delay due to the Omicron surge last year. So there's 3 primary categories here that go into this 1,300 number. So there's 672 that were unsheltered, which represented an 8% increase from the previous year. 428 people were counted in emergency shelters, which was a 10% increase. 200 were in transitional housing, which was a 9% increase. Some demographics over here. So 40% of the people counted were women, and 59% were men. And 344 that were counted were chronically homeless. And that was a 54% increase from the previous year. 113 identified as survivors of domestic abuse. And that was a 122% increase from the previous year. And 31% of the people counted identified as people of color. And then according to the American Community Service Survey of 2021, 19% of our Clark County population are people of color. So you can see that homelessness disproportionately affects people of color, even within the point in time count numbers. So let's talk about that increase in people within sheltered count. We counted 428 people in 2023 and 389 last year, which was a 10% increase. So part of the reason for that, Bertha's Place opened to full capacity, and we had a new safe living community, Hope Village. So we were able to put more people into shelter, which is often what we see with the point in time. The sheltered part of the point in time count is since those shelters are almost always full, it's really a measure of how many beds we have to put people in. That's where we see these increases. And there were 9% more people in transitional housing. So we had more family shelter beds this year in comparison to last year's count. There were 13 more family households staying in emergency shelters this year. And 2023 is the first year that we've counted more families in shelters than in unsheltered situations. So in previous years, that unsheltered number of families has always been higher than the number that were in shelters. And this is the first year where that balance has tipped a little bit. So in 2023, we also continued stemming the growth of our unsheltered senior numbers. So this is something we've been tracking across the last several years. It's been an area of concern. Since 2017, we had been seeing a consistent annual growth in the number of seniors age 62 plus experiencing unsheltered homelessness. So back in 2017, that number was only 3 in our point in time count. And that for several years after 2017, it was pretty much tripling every year. So 3 is a pretty small number to start, but in the next year it was 9, and the next year it was 30. And so that was where it was getting alarming, that we were seeing this number just expanding and expanding. So we were relieved last year when that number slowed, that rate of growth slowed. And we believe that was at least partially due to the fact that in early 2022, Bertha's Place opened and it was prioritizing seniors age 55 and up. So we had a place that was prioritized for those unsheltered seniors to go. So in the 2023 point in time count, the unsheltered seniors age 62 plus count was 40. So last year was 37, this year was 40. Still a slight increase, but not to the level that we've been seeing in previous years. There was an increase in unsheltered singles or couples without children and the chronic homeless population. So we'll talk about that in just a minute. So we saw a 15% increase in the number of unsheltered single individuals or couples without children, 527 in 2023 compared to 457 in 2022. And then the chronic homeless number of unsheltered individuals increased 78% from 2022. Now, I believe that part of that the increase, so chronic homeless is a very specific definition from HUD to qualify as being chronically homeless. You have to have had multiple episodes of homelessness, and then you became housed for a while, and then you experienced homelessness again. You have to have multiple episodes across, I think it's 4 episodes within 3 years, or you have to have a continued experience of homelessness longer than a year. So those 2 requirements, or one of those 2 requirements, plus you have to have a disability. So physical, mental, chronic health, some kind of disability as well. So if all of those are met, then you're counted as somebody who's experiencing chronic homelessness. And because those are kind of like very specifically worded requirements, they tend to fall at the end of a survey when we're doing our point in time count survey. I really think that the part of this increase was due to the fact that we had these professionally trained outreach workers doing this point in time count that were familiar with these terms and familiar with the people, so that they could have a longer conversation so they could get to those questions. So I'm looping back to where I really see that benefit in having all these year-round professionally trained outreach workers that are familiar with our community and the people in it. So nearly 2 out of 3 people experiencing homelessness do not sleep outside. So 38% of the people surveyed indicate that they do sleep outside, but 33% of people stayed in emergency shelter, 15% of people in transitional housing, and 14% of people surveyed slept in their vehicle. So, you know, sometimes we hear from the community, you know, when they think of homelessness, they're thinking about the most visible form of it that they've seen, you know, with a person on a street corner or a tent or something. But it's just important to remember that that's only a fraction of the full, you know, people in our community that are experiencing homelessness. And we talked a lot about shelter, the number of people going into shelter, and shelter is great. It's a really important part of our homeless crisis response system. People are, you know, they're safe from the elements. They feel more secure. They can work with their case manager and you know, come up with a plan to help tackle some of their challenges. But anyone in a shelter, as we can see in this point in time count results, is still considered unhoused. And so the goal is to move them into some type of permanent housing or unit, so they're no longer experiencing homelessness and would be counted in the one time count. So to do that, you know, we have to deal with the, you know, part of our challenge here in Clark County is our affordable housing crisis. So here's a couple numbers related to that. So the spring 2022 apartment market report showed a 2.7% vacancy rate for 1-bedroom apartments and 2.9 for 2-bedroom. And then to be able to afford, you know, one of those units, if they're able to find it, the current housing wage needed to afford an average 1-bedroom apartment in Clark County is, in 2023, $30.96 per hour. So just last year, when I was doing the point in time count reviews, that number was $25.60. It's gone up another $5 in 1 year. So, you know, in summary, I really think one of the benefits to our system in this last year has been those year-round outreach workers that were able to help us conduct this count. And, you know, our investments in our emergency shelter and other programs, you know, have all benefited our system. Other communities in their point in time count results have shown, you know, higher increases in the county. Any questions?
Hi, Dale. I do have a question. This is Jamie. Do you happen to have the breakdown of demographics for people who are unsheltered versus sheltered?
Yes, I can send that to you. I don't know that that's one that is actually on our website, but we do have that. All those numbers, those different breakdowns are reported to HUD. So yeah, I could.
Yeah,
send
I'm
that
interested.
to you later.
Yeah, particularly in how many people of color are sheltered versus unsheltered. Thanks.
Dale,
This is David
do you
Coleman.
have
Can you
any?
hear me?
Yeah, Dale, can you hear me?
Yes.
Yeah, okay. Do you have any stats for the Camas Washougal area that I can get?
Yeah, so we don't necessarily have them broken down in the point in time count by area like that. We do every year in our annual system numbers report, we have a zip code report. I don't know if you've seen that yet. But that allows you to click on a specific zip code and see the number of people who reported Camas or Washougal as their last permanent zip code before they became homeless. So that's one area where you can see some numbers related to that. And that would be for a whole year, not just for one day.
Thank you.
I would like to see that data, Dale, if that's possible.
Which data?
The data that you answered was available for Mr. Suggs.
Oh, for the zip code report?
Yes, if that's the closest thing that you have available.
Yeah, I can send that link. to go out with the notes for the zip code report. You can find it and then click on it. So it's a heat map. By default, you'll see the zip codes that have the highest rate. But anyone you click on, it'll tell you the total number for that year. And then also their primary reason for homelessness that the people provided.
Dale, one other question. Does this include folks that are in jail?
So people that are currently in jail on the point in time count are not allowed to be homeless. Because I think part of the reason is that HUD is viewing is that they didn't need shelter on that night. It's, part of it is to see, like, how, does that make sense?
I will also include the link to the dashboards for Council for the Homeless website for all the data in the follow-up email. I believe David had a question.
Yeah, can you hear me?
Yes.
Yeah. I was glad I got to speak to the Council for the Homeless CEO. She was very kind. I talked to her at length and gave her lots of information about the deaf community and some of the issues that we have trying to get them housed. There's specific data that is not collected on our people, like in the point of time count, and I'm not sure how to get questions asked for the point of time count. We need to get data collected specifically on people that use sign languages versus people that have hearing loss, and that includes people who have it as a first language and people of deaf culture. That includes both hearing people that use ASL as a first language as well as deaf people that use as a first language. And that includes Native Americans and immigrants that use a sign language as well as people born in America. These are very important data, and I know this, but legislature doesn't know this, Congress doesn't know this, but I know this. The deaf community knows it's desperate that we need to have this data. And without this data, we don't have rights, and they don't understand that deaf house hoppers are getting excluded and pushed away, saying that you don't qualify for housing, you're vulnerable and get extremely scared. There's thousands of deaf people in Clark County that could become homeless at any time. The housing price is going up. It's just a matter of time. We're going to have a major problem here. And by the way, just to inform everyone here, because this is on record, I'm an SSP for the Seattle Deafblind Service Center, and I've been informed that deafblind people of Seattle, they're coming to Vancouver. We need to be ready. There's going to be a lot of deafblind people moving here, and we need to be prepared for that. So, Dale, what can you tell me, or who should I contact so I can get questions put into the point of time count for the future? What should I do?
Yeah, David. So I would be a great contact for that. My email, I think you'll have my email address. So we do, one of the great things about that app, that Counting Us app that I mentioned, is we do have the ability to add custom questions to it as well. So that is something that we could, when it gets time to start reviewing for our 2024 count, and we're seeing what questions we want to add. If we do, we could potentially add a question related to that. So you'll have my email address. Just,
I have it.
Well, you will, I think, when the meeting minutes go out. So
okay, I gotta make sure I have your, yeah. Because I want to be in contact with you, and I'll add the CEO of yours, and we'll have a conversation to make sure we get the correct wording for the future PIT so that we get data, because without data, nothing happens.
Yeah, I'm a believer in data, so yes.
Thank you, Dale.
Dale, we have a question from Amy in our conference room.
Yeah, I was wondering, we're so close to Oregon, Portland, people sometimes reside here and be homeless in tents and stuff. And then during the day, they go over to Portland, whether to do the recycle cans or to whatever they've got going on. And I'm wondering, what is there, like, a point in time count? I know they have a point in time count, but do you know where to locate it, or have we thought about that at all between people, especially with them having that, their tents have to be down at 8 a.m. and then put back up at 8:30 or 8:30, whatever p.m. So they're coming over here, so they don't have to kitchen every day.
Yeah, so across the river, they're doing their own point in time counts as well. And one of the questions that we ask in our survey is, where did you sleep last night? And so, or did you reside in Clark County? So we are, trying to not count people who, maybe stayed in Portland that night and then came over in the morning for the Project Homeless Connect event. So yeah, we do try to, filter that out into the count. But yeah, so yeah, there are counts going on in every county, and we're all trying to just count the people that are residing at ours.
Thank you.
This is Rob Perkins. I have a question.
Hi, Rob.
Hi. I apologize for the camera. I just got back from out of the country and I don't look great. I continue to think about homeless data that's reported through the school districts pursuant to McKinney-Vento. And I'm trying to figure out a way to cross this with the point in time count and the other data that we get. This kind of dovetails with something David was saying about, I guess, folks in the deaf, hard of hearing culture, house hopping. We know that's happening in the McKinney-Vento counts that we built. Is there a way to cross this data so that people with housing instability can be seen for local use?
So by housing instability, so one of for the specific point of
It's that I'm aware that the point in time count doesn't take into account couch crashing or staying with a friend or something like that, but that's still housing instability. And for our local efforts, at the very least, I'm also aware that HUD doesn't count those. That's not homeless under that particular part of the law. But for our local purposes, someone whose housing is not stable could become homeless. They're on a trajectory, and being able to see very clearly what that's like. How do we gather the data and I guess cross it so that we can understand the picture more holistically? And is zip code the most granular that you have?
Yeah, as far as location wise in Clark County, the zip code is yeah, that's the best we have right now.
Hey, Dale and Rob, one thing that can be done is if you look at the homeless system numbers, every year the Council for the Homeless publishes that year's homeless system numbers, and they do it about this time of year. The 2022 homeless system numbers, I think, were just published in the past 2 weeks. You can look at the number of households that called Council for the Homeless, their housing hotline, for assistance, and you can look at the number of households that were assessed for housing programs. So you can call someone for assistance without meeting HUD, like you just needed housing assistance. You are self-determining that. It's like these households are not like we meet the HUD definition, yes, no. So they'll call and ask for assistance, and then they get assessed for a housing program. And that will be more about a vulnerability assessment. So if you're looking for a delta, the gap between how many people say they need assistance, how many people have been assessed for assistance, that gives you one gap there. And then you can also look at how many people accessed, entered a housing program, which will be different than a shelter one. So there are a couple ways you can kind of try to get to where you're going at, Rob. But that's where I would start.
That's a great point, Michael. And that report, that annual system number report, is also available on the Council for the Homeless.org's website. You go to data and system numbers, you'll see both the point in time count and the annual system numbers.
Does the numbers that OSPI get on their school report cards, those are different than because they have homeless on there, how many students are homeless in each school?
They have student numbers, and this is something that's more Melanie's expertise in her role with school district than it is ours. But I'm looking for a way to cross all of that data and get a better picture of what the stressors are on people in greatest need.
Yeah, the school districts report those numbers for their district to OSPI that appear on their dashboard that each school district does. And Evergreen this year hit just under 1,400 students that are identified through McKinney-Vento, which means majority of them are couch surfing, but very unstable. But we do send our report to Dale when it's point in time count for our families that are experiencing literal HUD homelessness, so that they are counted in that number.
Looks like we have a question from Counselor Diana Perez, and we are short on time. And so this should be the last question for today.
Just to piggyback a little bit on the language, is there a way to also include limited English proficiency among some of the possible questions in the future? And then I didn't catch who the consultant was that was hired by the community needs for the community needs assessment earlier in the presentation. Can you remind me who that is again?
But we use Rachel Williams Consulting. We did a request for proposals from and received 3 responses. And Rachel actually has done work for us in the previous community needs assessments.
Okay. All right. Thank you.
Thanks, Diana. Yes, we can, we'll review all these questions and reach out once it comes time for the next point in time count plan.
All right, thank you, Dale, for presenting and sharing all that information. It sounds like there's a lot more available on Council for the Homelessness website, so feel free to check it out. We have just a few minutes for open public forum if any of our guests would like to speak. Now is your time.
I do, Amy Rourke, the Division of Child Support, they have a work group that is basically every 4 years, they're supposed to go in and make sure that the economic guidelines and self-sufficient is all up to standard, you know, it's, as cost of living goes up, everything kind of goes up. And on, I guess, Rebecca will probably send out the form that anybody that they have a public comment coming up on the 27th and 28th, 26th and 27th. Anyways, Rebecca will send that out. And they can join virtually, or even if they just want to put in anything, anybody that has dealt with or goes through the child support has comments on what we're doing. Like, for instance, basically they abate when people go to jail for 6 months or more, they will abate their child support to $10 a month to make it affordable for them when they're in there. And so, like, we have a suggestion right now of when people are court ordered to do drug treatment or mental health, we're trying to see if we get that abated just for 6 months, so they're not acquiring a huge debt in this time that they're not able to do anything and they can work on themselves. And so stuff like that. And like I said, Rebecca will send that out. And if you know anybody that would be interested in, we're taking everybody's comments and going through those to decide what works best, I guess.
Great, thank you.
And one more thing is the working families tax credit. Still, it goes till December 31st. Anybody, I think they just made it over about a little bit over the halfway point. I think they said 400,000 people qualify in Washington State. And we're just a little bit over, I think, 200,000. So there's still all these people that haven't even, and their taxes are usually done. So they can, so it's a separate thing. It's our state earned income credit, like the federal earned income credit. This is the state's. And so anybody that hasn't applied for it to do it, they can get anywhere from $300 to $1,200 back.
Great, thank you. All right, well, thank you so much, everyone, for joining us. Thank you to our fabulous presenters. We will see you at our next meeting on September 6th. Thanks so much.
Goodbye.
Goodbye, everyone.
Bye.